Hi, my name is Ketki Joshi.
Hi, my name is Mona Patel, and we are the principal investigators for this research.
First of all, I would like to thank Robert Wood Johnson Foundation for giving us this funding opportunity. This program has been designed keeping in mind population's health, well-being, and equity impacts of specific policies. So the program that we are planning to apply is named as Fresenius Medical Care Physical Activity Program Commit to be Fit. So a little bit introduction about why we are doing this program and the importance of physical activity. So physical inactivity is considered a major public health threat as it is associated with many risk of chronic diseases like cardiovascular diseases, diabetes, and even some types of cancer. Though physical inactivity is one of the risk factor, it is also a modifiable risk factor, and these chronic conditions can be prevented with some changes in your daily lifestyle. So adult Americans spend a substantial portion of their hours at their place of work. But unfortunately, modern workplaces frequently lead to many health risks, like desk jobs lead to physical inactivity. Workplace stress can lead to poor sleep, poor dietary choices, and even cigarette smoking in some cases. So, all these factors in combination can put the workers' health at risk. But the good news is that the workplace also present a good opportunity for health promotion programs. And scientific studies have also shown that when done right, workplace health promotion programs can improve the health of the employees. It can reduce the healthcare cost, increase productivity, and overall, it's a win-win situation for employees as well as the employers. So most of these employees don't engage in any physical activity due to lack of time. So our Commit to Fit program will encourage the employees to participate in physical activities during their office hours. So little information about the work site. So the research where we are conducting is Fresenius Medical Care, and it is located at Waltham, Massachusetts. It has over 2,000 employees. It's a premier healthcare company focused on delivering the highest quality care to its people. So every year they conduct a health assessment on their employees to increase their productivity. So this health assessment revealed that 50% of their employees were borderline overweight, 8% of them were obese, 60% of these employees had some musculoskeletal problems like a neck and back pain, and some employees even reported early onset of cardiovascular diseases and diabetes. And 40% of these employees engaged in very light to moderate physical exercises. They have also reported that these health problems affect their work-life balance to some extent.
Physical inactivity is a major public health concern. Mostly the desk jobs prevent the employees to engage in any physical activity. So the Fresenius Medical Care and Long Island University healthcare professionals came up with a Commit to Fit program for its employees to engage in physical activity during their office hours. So the goal of this program, Commit to Fit, is to positively encourage physical fitness, healthy eating, and improve overall health of the Fresenius Medical Care employees. In this program, we will be mainly focusing on the three main target areas. That will be first is obesity, second exercise, and third nutrition. Currently, there are no worksite physical activity policy, making it difficult for the employees to be physically active. After the successful evaluation of this program, we can assess whether or not the worksite physical activity policies are necessary for the employees' well-being. For our research approach for this program, we have selected a CDC workplace health promotional model which has four steps. First, health assessment, second, planning, third, implementation, and fourth, evaluation. We have selected 200 participants from the regulatory department in the Boston branch of Fresenius Medical Care. These employees were either borderline overweight or engaged in very less physical activity. We have excluded the participants who were pregnant or lactating mothers or had an inability to walk. Starting with the research approach, the Commit to Fit program will be starting from January 1st, 2018 to July 1st, 2018. It will be a 6 months intervention-based program utilizing the pre-post experimental study design. There are four steps in the study design. The first step in the research approach is workplace health assessment. We will conduct a baseline survey on this physical activity, nutrition, and weight assessment before the study will be conducted. The second step in the research approach will be program planning. There will be three main components of this intervention: to distribute pedometers to the participants and ask them to set a goal to achieve 10,000 steps a day. The second, installing treadmill stations on each floor for walking breaks. Third, the educational sessions regarding physical fitness, diet, and nutrition by the experts. We have come up with three hypotheses for this program. Hypothesis 1: this study will show increased physical activity among the employees following the intervention. Hypothesis 2: this study will increase the knowledge about nutrition and dietary habits among employees. And Hypothesis 3: this study will show evidence of reduced weight among the employees. All the above three hypotheses would be measured using a CDC worksite health scorecard.
Now, the third step of our research approach is implementation and research activities. Now, the use of pedometer is one of the most important component of our intervention. Each employee will be provided with an activity kit which will include a pedometer, water bottle, green tea pack, a commit to be fit t-shirt, and a brochure listing the timeline of events of the program. Employees will be divided into teams of 8, and each team will have our representative to record the daily pedometer recorded steps and to remind them they have to be active. We have planned that in order to motivate the participants, the team with consistent 10,000 steps by the end of the week will be given gifts or prizes. Now, the second component of our intervention is installation of treadmill stations. This intervention will also help to achieve 10,000 steps, and the treadmill machine will be installed on each floor or section of the department. Employees can have access to it 5 to 6 hours per week, anytime between 9 to 5 p.m. The treadmill will help as a reminder and ensure that participants would not have to go far away to take walking steps. And our representatives will always be there to monitor the physical activity and record their time and steps taken during the utilization of the treadmill.
There will be sessions in the form of presentations and demonstration by physical fitness experts. These sessions will offer to 15 to 20 minutes classes during breaks, which will include aerobics, abdominal workout, stretching, yoga, pilates, weight and stress management on each day of the week. Twice a week there will be healthy eating, nutrition and healthy cooking sessions. They will involve mainly in healthy alternatives for eating, including how to make a healthy lunchbox, discuss barriers to healthy eating tips to healthy cooking, information on stocking the pantry, and how to substitute higher fat ingredient with a lower fat. These cooking sessions will be conducted every Wednesday and Friday from 4:30 to 5:30 p.m.
Now, the last step of our research approach is evaluation. This research will be evaluated at the end of 6 months using CDC Worksite Health Scorecard. It is basically a tool which is used to see if the implemented evidence-based health promotion interventions at work sites are working. So, for our research purpose, we will modify this scorecard and utilize the questionnaires using only the components of nutrition, physical activity, and weight management. Now, our research team comes from different backgrounds. Along with me and Mona, who are the principal investigators, who belong to public health field. We have two physical fitness experts, two nutritional experts, and we also have other three public health experts who will be responsible for taking the health measurements, speedometer steps, and the other health related information and surveys. And we will also have volunteers from Fresenius Medical Care who will support us during this entire process. Lastly, I would just like to thank for giving us this opportunity, and I'm hoping that our proposal will suit this funding opportunity. Thank you.